If you're looking for holistic remedies to help your child's ADHD symptoms, you are in the right place. ADHD is one of the most common behavioral concerns I see as a pediatrician. Many parents, like you, look for holistic approaches to help their children with attention deficit disorder. And specifically, they're looking for solutions that avoid medications like stimulants and pharmaceuticals. Hello, everyone. I'm Dr. Eileen Shi, a board-certified pediatrician. I work holistically with parents who want a child-centered approach to solve their children's health issues. So if that sounds like you, make sure to subscribe to the channel for more content just like this. As a holistic pediatrician and mama, I know how pervasive ADHD can be among children. But before we delve into discussing the treatment options, let's cover the basics of what ADHD is and its core symptoms. Attention Deficit Hyperactivity Disorder, or ADHD, is defined as a common neurodevelopmental disorder characterized by persistent patterns of inattention, hyperactivity, and/or impulsivity that interferes with functioning or development. It is also influenced by genetics and environmental factors. And for more on the evaluation process of ADHD, here's a video just on that. Now that we cover the basic understanding of what ADHD is and how it shows up in kids, let's go over some holistic approaches and remedies that actually make a difference, or shall we say, move the needle when it comes to children with ADHD. Overall, research in the last 8 to 10 years has increased our understanding of nutritional factors that contribute to symptoms of ADHD. In general, these studies show a correlation, not causology, between having deficiencies in these vital elements and the manifestation of ADHD. First up, magnesium. Magnesium is an essential trace element that plays a role in hundreds of processes in the body, from protein synthesis to DNA repair, and many more like muscle function and blood pressure regulation. Having magnesium deficiency is associated with cognitive disturbances like fatigue, lack of concentration, aggression, nervousness, and mood swings. And similarly, in children, magnesium deficiency has been shown to correlate with ADHD as well as other behavioral symptoms. Therefore, supplementing with oral magnesium is thought to minimize deficiencies in magnesium in patients who have ADHD. Now, magnesium is found in our diet, like green leafy vegetables, nuts and seeds, whole grains, and beans and lentils. To learn more about the different types of magnesium supplements, and there's so many out there, and how they work, here's a video on that, and the link is in the description below. The exact amount of magnesium supplementation is usually weight and age dependent, and this would be a great question to check with your pediatrician. By the way, if you found this video helpful, please give it a like and subscribe to the channel so that you will be notified of more content just like this. Next up, vitamin D. Now, studies on vitamin D have shown good evidence supporting the link between vitamin D deficiency and ADHD. We know that vitamin D plays an important role in the central nervous system and mental health, and children and teens with ADHD have lower vitamin D levels compared to children without ADHD. There is good evidence supporting that vitamin D supplementation of about 50,000 international units per week for 8 weeks can improve behavioral function and mental health in children with ADHD, specifically improvement in emotional and peer problems. Now, don't take that vitamin D dose to heart because it does depend on a child's age and other health issues. So be sure to check with your physician. Iron. Children, particularly those under 7 years of age, are overall a population group that is most vulnerable to having iron deficiency, which leads to iron deficiency anemia. We know that iron is essential in brain metabolism, so iron deficiency can cause biochemical imbalances of neurotransmitters such as dopamine and serotonin, decrease in myelin production, which is that protective sheath that covers the nerve cells in the brain, impairment of synapses across neuronal cells at the cell junction, and a decline in function of the basal ganglia, which is part of the brain that regulates and processes emotions and sensory information. As you can see, there are many reasons why children with iron deficiency can induce or worsen brain processes in children with attention deficit hyperactivity disorder and autism spectrum disorder. Now, if you're thinking about adding iron supplements to your child's diet, it is best first to assess your child's iron levels and to address this with your pediatrician. Omega-3. There's been a lot of talk about omega-3 supplementation for children with ADHD. And when we talk about omega-3s, these are polyunsaturated fatty acids that are essential fatty acids, which means that the body can't produce it by itself and therefore must be obtained through the diet. The two best studied omega-3 polyunsaturated fatty acids are EPA and DHA. And there are many studies suggesting that deficiencies in these fatty acids are associated with brain disorders. This is likely because these essential fatty acids are neuroprotective, as they have an anti-inflammatory quality that inhibits free radicals and oxidative stress. They also work to regulate neurotransmitters. And there is good evidence suggesting that omega-3 supplementation improves symptoms of depression and Alzheimer's disease. While this doesn't indicate a cause and effect, we know that youths with ADHD have lower levels of polyunsaturated fatty acids. So what happens if you take omega-3 supplements? Well, there is some evidence showing that omega-3 supplementation improves executive functioning in children with ADHD. But more studies are still being done on this in regards to the safety and its effectiveness. Lastly, I want to mention that there are many studies looking at the correlation between low levels of zinc and selenium to ADHD. As of now, there isn't enough good evidence suggesting that supplementing with these elements would lead to improvement of ADHD symptoms. So I will table that for now until there is more solid science-based evidence. And aside from nutritional supplements, are there other considerations that can help your child with ADHD? Well, the tenets of good health include a balanced diet, quality restorative sleep, and daily exercise. These are still the foundation of a healthy and balanced brain. Remember, you can have the best supplements in the world, but without a balanced meal, quality rest, and daily movement, it would be very difficult to achieve the best outcome. I hope this video gives you some insights about natural and alternative remedies to consider implementing in your child's health regimen. This video content is intended to be an educational resource. It does not replace evaluation and treatment that is best done with your child's clinician. ADHD is a common behavioral and neurodevelopmental condition in children and even in adults. Having a child with ADHD can mean having disruptive and stressful interactions at home and in your day-to-day activities. I hope you feel encouraged to start an open conversation with your child's health team to determine the best options to help your child in achieving his and her best self. In our Las Vegas-based practice, we work with families one-on-one, offering concierge, individualized care to each patient holistically, minimizing the unnecessary pharmaceuticals and treating the root cause. To learn more about how you can work with us, click on Become a Member and fill out the information so that we can schedule time to chat. Thank you all for watching. See you next time as we navigate the world of holistic pediatric medicine.